All right, ladies and gentlemen, people from Department of Public Health, Clinical Medicine, and other sections who have joined us, those who are joining me for a short course, you're welcome. My name is James, and I welcome you to Essential of Epidemiology. So our first lecture, of course, you already have these notes. You grab your notes printed or in soft copy, or else you can be following me from my screen, and that's my contact. But this contact is only available on WhatsApp, and the email address is also there. All right. So I'm going straight without wasting time. We are starting with our first topic. That is introduction to epidemiology. And at the end of that topic, I expect you to be able to define what epidemiology is, identify the main issues in the definitions, that is to say, some of the applications in the definitions, and also be able to discuss the uses of epidemiology. Okay, so I always have my explanations broken down in a very simple way that even a 15 years old can understand. Because I understand this class is mixed up of diploma, certificate, and some short courses, and including degree students. So I'm going to make my explanations quite broken down in a very simplest term. All right, now our learning materials. I define epidemiology as the study of the frequency, distributions, and determinants of diseases and health-related conditions in human populations, and applications of this study is to promote health and preventions and control of health problems. So some of these key, uh, some of these are basically what I mean by the applications in epidemiology. Now, when talk of the frequency, we're actually looking at the prevalences and the incidences. So in that case, we look at if, let's say, for example, we have an outbreak of disease, and then whenever we are trying to study the frequency, it simply means we are trying to understand what are the total number of people who are getting sick or getting ill, and how many of them have died. And then this disease, what is actually contributing in its spreads or in its distribution? How is it spreading from one person to another? Determinants, what are the risk factors and what are the contributing factors that is supporting its spread? So in simple terms, epidemiology is the study of how often disease happen, how often diseases happen. Some of the diseases are very frequent. They happen again and again, and where they happen, why they happen as well, and how to stop and prevent them. So we study core four things. Number one, how often diseases happen. Number two, where they happen. Number three, why they happen, and also how to prevent them. Now, in simple terms, if many people in Uganda get malaria, the epidemiology will help us understand why malaria is common and where is it spreading most, and then how can we reduce it. So, the key ideas in epidemiology is based on the populations, not an individual. Epidemiology focuses on the population, not individuals, because I'm going to use a simple drawing to explain this. So, for example, when you look at the term epidemiology, you will see the word epi. All right. So epi stand for upon, and then we have dem or demio. So this stands for population, and then we have ology. So this is the study of. All right. So those are the key aspects of epidemiology, things that should carry along as far as the epidemiology is concerned. So this simply means that the study of epidemiology will focuses on population, focuses on the population, not individuals. Okay. So number two. So let me now get into these major components. Let me get into these major components that is subheading two. But I've broken down what we looked at as far as the definition is concerned. So the major components which are actually derived from the definitions, applications, or the components or the scope of epidemiology. So number one, we have populations, and that's what I was explaining by saying that the epidemiology focuses on many people, not just one person. So, for example, it means if malaria is affecting many people, that means it is important to study that particular disease compared to the one which is affecting few. All right. So frequency, it asks about how often. All right, how often, and in this case, we study how many people get sick or die. Uh, we also measure that, like I said before, by prevalence and incidence. So when I talk about prevalence, I'm referring to existing cases, which is seen also as morbidity. And then when I talk about incidences, I'm referring that to new cases. But we measure the frequency based on morbidity and mortality. All right. The morbidity, I think I will need a whiteboard. So allow me to get that for you. I will need a whiteboard. So allow me to get some whiteboard here. Okay. So so we measure the frequency. So we measure the frequency. We measure the frequency basing on one, morbidity, right? Morbidity, and this means people who are sick, people who are sick. Then we have mortality. Mortality. This is the people who die. All right. These are the people who die. So those are what we consider as we are making the measurement of the epidemiology. All right. So we clean our board. Clean our board. All right. So we are moving forward to we're moving forward to health-related conditions. But by the learning materials here, what I'll put here is that the frequency. This shows that epidemiology is mainly a quantitative science. Quantitatives meaning that is focusing on numbers. Are we together? The numbers. All right. So that's where I said before we base on the population. So in case malaria is affecting so many people, and we also have cancer which is affecting few numbers, epidemiology will derive or divert its studies more in malaria compared to cancer because of the numbers, and that is what I'm referring to as quantitative. Okay, so epidemiology is concerned with the frequency, that is to say, the occurrence of diseases and other health related conditions. So the frequencies, like I said, we measure it by morbidity and mortality rates, and I've explained it. So we are moving to the third application, which is health-related conditions. Now here, epidemiology is concerned not only with the diseases, but also with the other related health conditions, because everything around us, what we eat, what we do, affect our health. All right. So health-related conditions are conditions which directly or indirectly affect or influence your health. There are some of the things like the living lifestyles can indirectly or directly affect your health. Or there are some other kind of factors like poverty, unemployment, smoking. So all that can actually affect your health in one way or the other. So it is not going to be just about the diseases, but also about things like injury, smoking, poverty, nutrition, because all that can actually affect your health. Now, when you talk about distributions here, we are looking at where this distribution answers questions of where is it happening from. All right. So this refers to geographical distribution of diseases, the distribution in time, the distributions by the types of persons affected. So we look at the time or the seasons of that infections, frequency, and as well as uh, the types of persons, because we have categories, we have modifications of individuals. The elders, we have adult, we have the adult who are not elders, all right, all the old age. Okay, so we have the elders, adult, then we have the elders, we have the adult, and then we have the teenage, and then we have the youngs. All right. So we modify or we classify this because they may be suffering from the same disease, but there are different contributing factors towards the occurrence of these diseases as far as these individuals are concerned. So distributions will help us to answer where the diseases is happening geographically, and also when. That is the time and the types of persons affected. Okay, so where diseases happen could be the village, could be the country. When it happens, there we look at the season, or in terms of the season or year, and then who is affected by age, by gender, and by job. All right. So let's move to determinants. Now, I say that determinants are factors which determines whether or not a person will get the disease. Is a decisive factor. Whether the persons will get a disease or not. Now, factors that make someone get sick or stay healthy is, in simple terms, is what I mean by determinants, or maybe the causes. All right, so it will basically depends. Now, finally, applications or use of knowledge. Okay, use of knowledge. Now, application. What I'm referring to here is that what do we use this information for? All right, that's a question. What do we use those knowledge for? Now, we are saying the application of the studies is to the promotions of health and to the prevention and control of health problems. So this means that the whole aim in studying the frequency distribution determinants of diseases is to identify the effective disease prevention and control strategies. So therefore, it means we shall use the information that we study from the frequency distribution determinants to prevent disease, control outbreaks, and as well improve the health of the populations. Okay. All right. So we have here the uses of epidemiology, and I'm going to break them down as quick as possible. So number one, we are saying that to make a community diagnosis, and therefore in this case, the epidemiology helps to identify and describes health problems in a community. For example, the prevalence of anemia. So we are looking at the existing cases of anemia or the nutrition status of children. All right. So in that case, we want to understand the health problems in what? In the community. Now, number two, to monitor continuously over a period of time the change of health in the community. So in that case, we want to track diseases over time. We want to monitor the frequency, the continuous frequency of a disease over a period of time, and I want to monitor the continuous health of individuals in that community. So we shall do that by tracking diseases over a time period. Number three, to practice surveillance for a specific disease in order to be able to act quickly and so cut short any outbreak, for example, cholera. So what we are trying to do here is we want to detect outbreaks earlier, like cholera. We want to surveillance in this case, in this context, I'm referring to observation, all right, staying alert on specific disease so that you can detect in case of outbreak early enough so that you can be able to take actions and you find solution for that health burden, disease burden rather. Now, the next one is investigation of an outbreak, all right, of a communicable disease, analyze the reason for it, plan for a feasible remedy or solutions and carry it out, and monitor the effect of the remedy on the outbreak. Okay, so in that case, all we want to do is to find causes of the disease, all right? Find causes of the disease by investigating an outbreak of a communicable disease. Communicable disease, these are categories or diseases that spread from one person to another through different modes. Could either be body contact, through airborne, or maybe sharp needle sharings, etc., or maybe even from one person to another through birth. All right. So when this analysis is done, we can be able to find the actual cause of what? Of a particular disease. How did it happen? And what has caused it? So lastly, better planning of health services. So here we are saying to plan effective health services. Of course, when we have all this information at hand, then we can be able to implement effective health programs and services for our population. A short commercial break. So down here, there's some exercise of that introduction. Okay, I can just use that for your study as well as you reading the notes. So we are now moving to subheading 2, which is a disease causation. All right. So there we want to understand what makes disease to happen or what causes disease. Now, what I want you to be able to do is to define the cause of disease and discuss different risk factors for disease. Now, I define the cause of disease as an event or condition or characteristics or a combination of these factors which plays an important role in producing the disease. So a disease happens because of causes and risk factors. It happens because of causes and risk factors. It does not just fall from heaven. Now, we have classifications of these causes, because in order to understand them, we have to so in order to oh shit, this one, the battery is off. So in order to understand these causes, we have to classify them. And our first classification is primary causes. And these are primary factors which are necessary for a disease to occur. Okay, so the main thing that must be present for disease to happen is what we are referring to as primary causes, or the main cause. Okay, so for example, tuberculosis is caused by Mycobacterium tuberculosis, or in other words, is caused by bacteria. So that means bacteria is the primary cause of what? Of tuberculosis. All right, so we are saying that these are the factors which are necessary for a disease to occur, in whose absence the disease will not occur. All right, because of course, in the absence of a bacteria, we cannot have the occurrence of tuberculosis. Okay, so now the term etiologic agent can be used instead of primary cause for infectious causes of diseases. For example, Mycobacterium tuberculosis, like I said, is the primary cause, or etiologic agent of pulmonary uh, tuberculosis. So we are moving forward to the second classification, which is risk factors, or things that increase chance. So when I talk of risk factors, I'm referring to things that increase chance of disease occurrence. All right. So this is not the main cause, but they make disease more likely to occur. They're not the main cause. Okay. So we are saying that these are not necessary. They are not necessary causes of disease, but they are important for a disease to occur. And there are factors which are associated with an increased occurrence of disease. Okay. So these factors includes smoking, poor hygiene, weak immunity. They will not be the major or the direct cause of infections, but they will be the contributing factor. So they make disease, or it increases chances of disease to do what? To occur. Okay, so that will take us straight to uh, epidemiological triangle. Epidemiological triangle. Now the triangle here talks about the three factor, the agent, the host, and the environment. Okay. Now, for disease to happen, they happens because of three things which are working together, and that's why I use triangle, which brings those three factors together. So we have the agent. Uh, the agent is a factor that its presence or absence or excess or even deficit is necessary for the particular disease to occur, or an injury. Okay, so the agent, for example, would be virus, bacteria, or chemical. Those are things that their presence, their absence, or their excess, or even deficit will really contribute the occurrence of what? Disease. Then the host. Okay, the host. So the host is a person, or what we can call the reservoir, where the virus is going to stay before they can actually spread to another person. So this includes the body, the immunity, or the age. All right. Now, the environment is the surrounding, the weather, the hygiene, living conditions. So disease will definitely happen when these are not balanced. You see that? So let's proceed. But also we have some other additional factors that I've added here, which is social environment. This might not be directly environmental, but social environment encompasses with it several factors, the like of education, culture, diet, and some of the factors that might environmentally contribute to occurrence of disease. Also physical environmental factors like climate, I've talked about that, weather, or maybe the high, the density of the population. Biological environmental influences also are part of the environmental factors like vectors or humans or plants, which becomes, or some of them serve as reservoirs on infection. Reservoir is the host, or is where uh, a virus or an agent stay, survive, live, multiply, and spread into another one, to another host. So let's have a look at the natural history of diseases, and that is to say the stages of diseases. Now here, you should be able to understand the history of disease and different stages, and also describes levels of disease preventions. Diseases are prevented basing on the different levels, and the national history of diseases shows how a disease develops over time. So stage one is susceptibility. Now, susceptibility is the person who is at risk, but they are not yet sick. So when I talk about when they says you are susceptible, it means you are at risk, but you are not what? Yet sick. Basically because of some factors. For example, being unvaccinated. Uh, so we can talk about unvaccinated child. When you have a child who is unvaccinated and has already gone above the age, that simply means that child can it is he or she is susceptible to measles. All right, they are actually at risk of getting measles, although they are not yet what sick. Now, two, I don't know whether I have to explain more, but I think that's a bit clear. So, two, we have uh, pre-symptomatic or subclinical disease. Now, subclinical stage is a hidden stage, all right? Uh, Pre-symptomatic, or even before it shows up, it could actually be called asymptomatic, all right? So, in that stage, there might not be clear manifestations of the disease, but there would be some of the changes that disease is causing. We are calling it pathologic changes. The damages may start to occur in the body, and it is hidden. So it means that we know that some of the disease takes time longer than expected before you can be able. If you are at all, you are waiting to detect it through manifestations of symptoms without doing a medical investigation. like lab medical checkup rather. So uh, subclinical stage disease has started already, but there is no symptoms yet, and can only be detected by tests. So at that stage, you can't just understand it using any other thing like symptom, because there will be no symptom, no signs. So it can only be detected through uh, medical tests. Number three, we have clinical stage. The clinical stage. So the clinical stage is basically when a person shows signs and symptoms. So at that stage, the person has developed signs and symptoms of the disease, and the clinical stage of different diseases also differs in the durations. Others take longer, others have a short period, and the severity and the outcomes also are based on different types of disease. So the consequences of those diseases based on their severity and the outcomes are not the same. All right, for them, for measles and malaria have different period of time for them to manifest through symptoms, and also the severity and their outcomes are also not the same. All right, so the outcomes of the disease at that stage, the person may recover, or a person may recover with disability or death. Okay, so uh, a person will be experiencing, at least you will have a complaint of fever, pain, cough, and the outcome can be recovery, disability, or death. All right, so we have stage 4, which is the stage of disability or death, where disease may heal completely or end up causing disability like blindness, or eventually lead to death. And the simple summary of this would be that the epidemiology answers who is getting sick, from where, when, and why, and how do we stop it. Okay. All right. So that's all for that notes that you have, and I wish you all the best.